Welcome to the Cardinal Research Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
And good afternoon. I'm Dr. Kim Williams, and I'm Chairman of Medicine here at the University of Louisville. And you are joining us for a Cardinal Research Minute. Our inaugural research conference for this year was actually given by Dr. Roberto Bolli, who is the director of our Molecular Cardiology Institute. And Dr. Bolli gave a wonderful introduction and talking about the present and the future, as well as the past, for stem cell therapies for heart failure. Dr. Bolli, can you summarize your talk in 1 minute?
Yeah, sure. Thank you, Dr. Williams, for giving me this opportunity. So I basically use this talk to describe our translational journey here in Louisville to bring a new treatment for heart failure. Heart failure has a very high mortality, as everybody knows, and we still need improvement in therapies. We have been using stem cells, and specifically mesenchymal stem cells, from either the bone marrow or the umbilical cord to treat animal models of heart failure and now patients. So we have done several studies showing that intravenous infusion as opposed to intramyocardial infusion of cells is effective, and that repeated infusions are superior to a single infusion. And then we took this work and translated it into a clinical trial, the CATO trial, which we are doing now in Louisville and other centers across the nation, where we are testing the same strategies, intravenous delivery of mesenchymal stromal cells and repeated doses of cells in patients with chronic ischemic cardiomyopathy who have heart failure. So we are very excited about this study because if it shows efficacy, it would be really a game changer in heart failure and actually in cell therapy at large, because then we can give intravenous treatments to just about everybody in every hospital, even in outpatient clinics. The treatment would be less expensive and therefore available even to the disadvantaged populations who may not have the best health insurance, and that can be repeated multiple times rather than giving a single dose. You could envision a situation where patients with heart failure receive an intravenous infusion every 6 months or every year to maintain the beneficial effects. So we are very excited, and we are hoping that this CATO trial will show efficacy of our treatments.
Well, fantastic, and thank you so much for all your decades of dedication and science here at University of Louisville, really building the research programs and hope for heart failure and inspiring more investigation.
Thank you for your support, Dr. Williams.
And this has been a Cardinal Research Minute.